While electrocardiography, ECG, is a valuable diagnostic tool in assessing cardiac conditions, it does have certain limitations. Here are some of the limitations of ECG in the diagnosis of cardiac conditions. First and foremost, none of the ECG algorithms are 100% specific and sensitive. Yes, that's true. Take your time to digest it. 1. Limited snapshot. ECG provides a snapshot of the heart's electrical activity at a specific moment in time. It may not capture transient or intermittent abnormalities that occur outside the recording period. For example, if a cardiac arrhythmia only occurs sporadically, it may not be detected during a brief ECG recording. 2. False negatives. ECG may fail to detect certain cardiac abnormalities, especially in the early stages of disease. Some conditions, such as early-stage coronary artery disease or mild heart valve abnormalities, may not produce significant ECG changes initially, leading to false negative results. 3. Influence of patient variables. Factors like body size, obesity, lung diseases, and chest deformities can affect the accuracy of ECG interpretation. These variables can alter the positioning of the electrodes and impact the quality of the recorded signals, potentially leading to misinterpretation or difficulty in detecting abnormalities. 4. Operator dependency. Skill and experience of the healthcare professional performing and interpreting the ECG can significantly impact the accuracy of the results. Misplacement of electrodes, improper lead placement, or errors in measurement can lead to misinterpretation or misdiagnoses. 5. Limited spatial resolution. ECG provides information about the electrical activity of the heart along specific leads, but it has limited spatial resolution. It may not accurately localize the exact origin or extent of a cardiac abnormality. To overcome this limitation, additional imaging techniques like echocardiography or cardiac MRI may be necessary. Nonspecificity. ECG findings can be nonspecific, meaning that certain patterns or changes observed on an ECG can be caused by various cardiac and non-cardiac conditions. Further diagnostic tests are often required to confirm the underlying cause of the observed ECG abnormalities. Inability to assess structural abnormalities. ECG primarily focuses on the electrical activity of the heart and may not provide direct information about structural abnormalities. While specific patterns may suggest the possibility of certain structural conditions, such as left ventricular hypertrophy, the definitive diagnosis usually requires imaging techniques like echocardiography or cardiac MRI. It's important to note that despite these limitations, ECG remains a widely used and valuable tool in the diagnosis and monitoring of many cardiac conditions. Its non-invasive nature, affordability, and ease of use make it a valuable initial screening tool, often complemented by additional investigations for a comprehensive evaluation of cardiac health.